Let's explore methylphenidate, better known by the brand name Ritalin, a stimulant medication commonly used to treat ADHD. Ritalin works by increasing the levels of dopamine and norepinephrine in the brain. These chemicals are essential for focus, impulse control, and executive function, areas that are often underactive in people with ADHD. By enhancing these neurotransmitters, Ritalin helps improve attention span, reduce hyperactivity, and make it easier to stay on task. It's typically prescribed for attention deficit hyperactivity disorder, ADHD, and occasionally used for narcolepsy. So, how is it taken? Ritalin is available in immediate release, IR, and extended release, XR forms, taken once or twice daily depending on formulation. Effects kick in within 30 to 60 minutes and can last 3 to 8 hours. Common benefits include improved classroom or work performance, better time management and task completion, reduced impulsive behavior. Side effects can include decreased appetite, insomnia or trouble falling asleep, headache or stomachache, irritability, or mood changes. Important notes: Ritalin is a controlled substance due to its potential for abuse, should always be used under medical supervision, may require dosage adjustments over time. Bottom line, when used responsibly, Ritalin can make a meaningful difference in the lives of people with ADHD, helping them unlock focus and function. If you found this helpful, hit like and subscribe for more medical animations.